word autism comes from the Greek word autos, which means self. It describes a condition in which a person feels removed from social interaction. In other words, he or she becomes an isolated self. The full definition of autism is a developmental disorder of variable severity, characterized by difficulty in social interaction and communication and by restricted or repetitive patterns of thought and behavior.
The earliest well-documented case of autism goes back to 1747. Hugh Blair of Bourg was in an arranged marriage, and his brother sued to annul the marriage due to Blair's mental incapacity. The court documents describing Blair shows that he had autistic symptoms.
But it wasn't until 1911 when the word autism was first mentioned in medical literature. Swiss psychiatrist Eugen Bleuler used it to describe schizophrenia, which is a mental disease that is not associated with autism today.
In 1943, autism became even more defined. This is when the Austrian-American psychiatrist Leo Kanner came up with the term early infantile autism to describe the behavioral similarities in a group of highly intelligent children. He was studying some of the behaviors these children shared were a powerful desire for aloneness and an insistence on sameness.
A year later, in 1944, the Austrian pediatrician Hans Asperger published an article identifying autism as a communication disorder. He noted patterns of behavior that included a lack of empathy, little ability to form friendships, one-sided conversations, intense absorption in a special interest, and clumsy movements. Asperger also noticed that some of the children he identified as being autistic used their special talents in adulthood and had successful careers.
In 1980, infantile autism was given its own category in the Diagnostic and Statistical Manual of Mental Disorders, otherwise known as the DSM. This designation is very important since mental and health professionals use the manual to determine a patient's diagnosis. In 1987, infantile autism was expanded into autism disorder and finally given a set list of diagnostic criteria. In 2013, the DSM grouped different types of autism into one category: Autism Spectrum Disorders.
1 in 59 children being born now get diagnosed with autism. This is partially attributed to better diagnosis, but not entirely. In the last 40 years, we have seen a 1000% increase in autism. And just as the understanding of autism has changed over time, so have the theories of what causes it. When Leo Kanner identified autism back in 1943, he noted the lack of warmth among the parents of autistic children. This gave rise to the refrigerator mother theory, which blamed uncaring parents and traumatic childhood experiences.
Bernard Rimland, a psychologist with an autistic child, disputed the refrigerator mother theory. In 1964, he published an important paper that showed autism being the result of a neurobiological malfunction.
Then, in 1977, Susan Folstein and Michael Rutter published the first study of twins with autism, which showed that genetics definitely play a role. In 1998, a tiny study was published that supposedly showed that the measles, mumps, rubella vaccine causes autism. This study turned out to be almost entirely fraudulent, but its impact is, unfortunately, still felt today.
What we do know is that there are about 100 genes that increase the risk factor for autism. Scientists have also identified environmental factors such as prenatal exposure to toxins, parental age of conception, maternal nutrition, and infection during pregnancy.
As our understanding of what causes autism has developed, so have the treatments. In the 1920s, autistic children were exposed to electric shock therapy and put on special diets. In the 1950s, parents were blamed for being distant, so the common approach was to remove the child from the parents for long periods of time. In the 1960s and 70s, treatments consisted of LSD, electric shock, and behavior modification that focused on pain and punishment. Wow, things sure have changed.
These days, the gold standard treatment for autism is applied behavior analysis, otherwise known as ABA. Here with me on the subject is Taylor Heinsohn, who is going to tell us more about this treatment and how it works. Welcome to SOI, Taylor.
Thank you so much for having me.
What is ABA and how effective is the treatment?
ABA stands for Applied Behavior Analysis. It's been around since the 70s, so over 45 years of evidence-based practice that helps us understand why behavior is happening and what we can do to change what's happening before and after behavior to change that behavior.
That's great.
It's a really effective treatment.
And how will ABA work when other treatments in the past didn't?
Really good question. It works consistently across the lifespan, across all different types of diagnoses, across all different ages. Sometimes it's even used with animals and pets. It's very common in dog training because it is reinforcing behavior that we want to see increase in the future, and then we want to decrease excessive behavior that's inappropriate.
And what should everyone look for to ensure their ABA program is being done properly?
You really want to look closely at the data. Because ABA is a science, we analyze the data constantly. So it's ongoing intervention change based on what the data is telling us. If the data is going the direction we want it to go in, we continue treatment. If it's not, we change the intervention.
That sounds pretty good. And that is all for today. Thank you for coming and giving us info on the subject.
Thank you so much for having me.
Thank you. Back to you, Jesse.